Thank you for joining me today. In this video, we are going to learn more about Zoloft. Zoloft or Sertraline or Zoloft. This medication treats both anxiety and depression. Zoloft is a SSRI medication. It is selective serotonin reuptake inhibitor and widely used for first line medication for depression and anxiety disorders. It treats different anxiety disorder. It's generally well tolerated and has relative low potential for a drug to drug interaction compared to other medications. It is antidepressant medication and commonly used both primary and psychiatric practice. Sertraline or Zoloft is a selective serotonin reuptake inhibitor. It's anti-depression, but it treats both anxiety and depression, and it's well tolerated. Sertraline or Zoloft is FDA approved for major depression disorder, and OCD, panic attacks, PTSD, social anxiety, and premenstrual dysphoria disorder. So Zoloft is approved for different anxiety and depression disorders. Zoloft it's primarily blocks by inhibiting the serotonin transport. That is the mechanism of how Zoloft works. It decreases presynaptic serotonin reuptake. So it increases the serotonin in the body. It increases serotonin availability in the synaptic cleft. It produces downstream adaptive changes in the serotonin neutral circuits. Clinically important, general occur gradual rather than immediately. So it works gradual instead of immediately. Pharmacokinetics of Zoloft is that it is administered orally and is well absorbed in orally. Maybe it takes with food or without food, and it is protein binding 90%, 98% protein binding, and metabolized primarily in the liver, and it's eliminated mainly through the liver metabolic and feces. So it's good for the people who have, you can prescribe for the people who have the kidney failure because it eliminates and metabolizes the liver. The half-life of Zoloft is approximately 26 hours. So it will be in the body 26 hours. And half-life means half of the medication is eliminated, absorbed in half of the dose. It's eliminated and absorbed in 26 hours. Dose usually it's once a day for Zoloft, and general major depression disorder. Typically, starting dose is 50 milligram every morning, once a day. It's usually therapeutic ranges. It's between 50 milligram to 200 milligram a day, and maximum dosage that person can take for Zoloft is 200 milligram. OCD or obsessive compulsive disorder, typically starting dose for Zoloft is 50 milligram, similar to the major depression disorder, is 50 milligram per day, and usually ranges from 50 milligram to 200 milligram per day. Panic disorder and OCD, panic disorder and PTSD and social anxiety disorder, typically starting dose is 25 milligrams. So it's less than for the OCD and major depression. When the major depression and OCD starting dose is 50 milligram, panic attack and PTSD and social anxiety disorder, you can start with 25 milligram and then gradually increases. You will increase to 50 milligram if the 25 is not effective. Then therapeutic ranges, it's between 50 milligram to 200 milligram. And starting at a lower dose and reduce early treatment relative anxiety and activated. So start at the lower dose can reduce the anxiety and anxiety related mood disorders. Premenstrual dysphoria disorder, common regimen or common medication include continued daily dosage, intermittent dosing during the luteal phase of the period, and typical dosage is starting with 50 milligram and the gradual increase if that's not controlling the symptoms. For children, Zoloft is FDA approved for obsessive compulsive disorder in children and teenagers. For other psychiatric children who have other psychiatric disorder, use may be off-label and require carefully assessment of the risk and benefit for Zoloft. You want to titrate the dosage if the 25 milligram is not working. You want to start a low dose and increase gradually. You want to assess the tolerance because Zoloft has a tolerance. You want to also increase gradually on a response. You start low, increase lower and lower and lower. You want to avoid unnecessary rapid dose escalation. Older adult has the potential. Older adult and patient who have the sensitivity to the side effect may be benefit from slow titration. Therapeutic response, early response. Some patients experience improved in anxiety, sleep, appetite, and energy. So Zoloft, it improves the anxiety, sleep, and appetite and energy, and it's only prescribed those diagnoses that the FDA approved. Every medication has a benefit and risks. You have to assess that with the doctor, and you have to assess that with your patient. Only this medication is prescription, and only the provider can prescribe. This video is educational only. Within the first several weeks, the full it can improve the anxiety, sleep, energy, and appetite, but the full anti-anxiety control and depression control takes often 4 weeks to 8 weeks, so 1.5 months. Some disorders, particularly OCDs, may require long treatment and increase dosage gradual with higher doses. The common side effects of the Zoloft include GI, neurological, and sleep. GI symptoms and side effects of the Zoloft. Common adverse effects of the Zoloft include, for the GI, nausea, diarrhea, abdominal pain, and increased bowel frequency. Neurological, it causes a headache, it causes tremors and dizziness. Sleep, it increases the insomnia, and it increases also decreases the libido, it causes sexual dysfunction, delay organism, it causes dysfunction, and sexual side effects affected may persistent during the continued treatment. Important side effects, serious side effects that can happen from Zoloft include serotonin syndrome, because it increases the serotonin in your body. It can cause serotonin syndrome. Serotonin syndrome is a risk, and it increases. Zoloft combined with other serotonin medications. Symptoms of the serotonin syndrome include agitation, confusion, diaphoresis, which is sweat, tremors, hyperphagia, clonus, hyperthermia, high temperature, diarrhea. Severe cases are medical emergency. So severe cases of the Zoloft syndrome is a medical emergency, and patient has to go to the emergency room. High risk comorbidity is used for precaution, so don't combine Zoloft with a monoamine oxidase inhibitor or MOA inhibitor. Other Zoloft medications don't combine with tramadol, because tramadol also has that serotonin syndrome side effects. Certain migraine medications Linezolid, medication linezolid, methadone, blue, Johnson syndrome, Johnson-Worth, it's a supplement. Zoloft can carry a risk of suicidal ideation, especially children and teenagers. Anti-anxiety medications carry a black box warning regarding that it increases the risk of suicidal behavior to the children, teenagers, and young adults, particularly during the treatment and initiating the dose changes. You want to monitor new suicidal thoughts, behavior activation, agitation, irritability, increased behavior changes. This warning does not mean antipsychiatric medications should routinely be withheld when the clinical indicated, but you want to assess that risk for the children and teenagers. Zoloft, Zoloft may be precipitated or increase the mania. It may cause mania or hypomania or rapid mood swings. Therefore, screen for bipolar disorder before initiating or prescribing antipsychiatric medication. Antipsychiatric medication monotherapy should generally be avoided in bipolar disorder 1. Bipolar 1 disorder, which is the one that has mania, hypermania, hyponatremia, low sodium, selective serotonin inhibitor medications of the Zoloft can cause syndrome of inappropriate antidiuretic hormone secretion and low sodium. The high risk population that can have low sodium include older adults, patients who are taking diuretics already, patients with low baseline sodium, patients with significant medical comorbidity. Symptoms include headache, confusion, weakness, nausea, and seizure. Low sodium can cause that symptoms of seizure. It also Zoloft can create and has the risk of bleeding risk. Zoloft can increase a bleeding risk because serotonin contributes to platelet aggregation. That increase with aspirin. So if you take aspirin and Zoloft, it will thin the blood and it will cause increased bleeding risk. Also, if Zoloft is taken with SSRIs, so aspirin, SSRIs, anticholinergic medications, antiplatelet medications can increase the risk of the bleeding risk. Monitor the patient with significant bleeding. Discontinue Zoloft if the patient reports or if you see the severe symptoms of the Zoloft. However, a quick discontinuation of Zoloft may cause a dizziness, nausea, headache, irritability, anxiety, insomnia, and sensory deficit. So you want to discontinue Zoloft gradually, and generally prefer when long discontinue long term treatment. For drug-to-drug interaction, Zoloft has a fewer clinically significant enzyme P450 interaction than other antipsychiatric medication, but interactives remains clinically important. Important consideration when prescribing Zoloft. Zoloft is a relatively weak inhibitor of the CYPD26 at usual dose, that is enzyme for dopamine absorption, and combination with monoamine oxidation inhibitor is contraindicated for Zoloft because of the risk of serotonin syndrome. Both of them MOA inhibitor medication, which is other antidepressant medication, is class of antidepressant medication with Zoloft can increase the risk of the serotonin syndrome when combined together. Alcohol usage worsens the sedation, impaired judgment, and other side effects. So if you use alcohol with serotonin, it can increase the sedation, it can impair the judgment, it increase all the other side effects that we talked about. So don't take with serotonin with alcohol. Don't consume alcohol with serotonin. Contraindication for prescribing serotonin, it includes concurrently with monoamine oxidation inhibitor used with washout period for 14 days between them. 14 days between Zoloft and monoamine oxidation inhibitor, which is antidepressant medication class. Non-serious hypersensitivity to Zoloft is also contraindicated. Use additional caution for bipolar disorder, patient who have a bipolar disorder, patient who have seizure, because it increases the threshold of the seizure, patient who have a significant hepatic impairment, because this medication is absorbed and eliminated in the hepatic. It is metabolized and eliminated in the hepatic pathway. And if the patient has liver damage, it's contraindicated and used cautionally. Patient who have low sodium, patient who has increased risk of bleeding, be caution prescribing Zoloft for the patients who have bleeding risk, who have low sodium, who have a hepatic impairment, who have a seizure disorder history, or who have bipolar 1 disorder or bipolar 1. Any of these patients should be cautioned by prescribing this medication. Hepatic impairment. Zoloft is metabolized through hepatic liver. For the patient with mild liver damage, low dosage and less frequent dosing may be appropriate. Zoloft is generally not recommended in a moderate to severe hepatic impairment patient. Renal impairment, Zoloft generally does not require dose adjustment solely because renal impairment, because Zoloft renal elimination is unnecessary because the Zoloft is eliminated in the liver to the feces. For pregnant women, Zoloft is commonly considered when antidepressant, anti-anxiety, antidepressant medication is clinically indicated for pregnant women. Consider a severe, consider Zoloft is appropriate or can be described to during the pregnancy, but you want to consider a severity of the mental illness, previous responded to this medication, if they had this medication, if they responded well. So even though pregnant women can be prescribed this medication, there is a caution and guidelines that you have to follow. You want to consider the severity of the illness, is if this medication is necessary, if there is a previous response to this medication, risky of the untreated psychiatric illness, that's what you want to consider. Potential neonatal adaptation symptoms, rapid persistent pulmonary hypertension of the newborn. So it can increase the blood pressure for the newborn. Treatment decisions should be individualized and based on risky and benefits assessment. Lactation, Zoloft generally is produced low concentration in breast milk, so it goes to the breast milk. So that means the child can expose to Zoloft even though you prescribe this medication to the mother. Also, you have to consider this medication can be exposed to the child because child is absorbing that Zoloft through the milk in a lower dose. It is commonly considered one of the preferable antidepressant medication during the breastfeeding when treatment is indicated. You want to monitor the child also from the side effects. You want to monitor the infant for sedation, feeding difficulty, irritability, poor weight gain. Those are the side effects of Zoloft. Those are the side effects that the infant can gain from breast milk through the breast milk. You want to monitor, and unlike the lithium or many antipsychiatric medications, routine blood level monitoring is not necessary for Zoloft. However, you want to monitor a clinical severity of the depression anxiety symptoms, suicidal ideation. You want to also assess mania. It can increase the mania and hypomania symptoms. You want to also assess the medication compliant, if the patient is taking the medication the way you prescribed. Sexual side effects symptoms, if the patient complaining about GI symptoms, side effects. Laboratory testing, when clinically indicated, include the sodium. You want to check the sodium level. Pregnancy testing, liver testing, liver function testing when indicated. Patient education for Zoloft include teaching the patient taking Zoloft consistently each day to be effective. It can be taken with food or without food. You want to also teach the patient therapeutic important, maybe take several days and several weeks. Do not stop the medication quickly, and you have to consult with your primary and psychiatrist. Rapid severe agitation, confusion, fever, muscle rigidity, and abnormal movement is the first effect that you wanted the patient to watch for and report to the provider. For the missing dosage for Zoloft, if you miss the dosage, if the patient missed the dosage, educate them to take it when you remember. You want to educate the patient to take the medication when they remember and it's close to the next dosage. Do not routinely double the dosage. Zoloft, it is broad. It's a broad psychiatric medication used commonly, favorable for cardiac. Broad psychiatric use, commonly favorable when the cardiac safety is important. Thank you for joining me today. Please prescribe and join me again. Thank you.